freedom, and I hate to think that many patients who've had other portable oxygen concentrators didn't feel free to leave the home. They didn't feel comfortable going long distances without having some anxiety about what they were going to experience when they got to a battery life that was too low, or their device didn't plug in to a receptor so that it could be recharged. But I think for many of my patients, it's the ability to get out, feel comfortable, to go with family, to travel. I've had some of my patients actually travel quite far with their device and come back and feel confident that their oxygen needs were being met. So patients place a large amount of confidence in their clinicians to make not just the right decision, but also to pick the right devices when we start talking about oxygen therapy. And I think the idea that at the very initiation of oxygen therapy, you can either convince a patient to be compliant with CAIRE, or you can convince them that the doctor doesn't understand exactly what I'm going to be going through now that I have to wear oxygen, has everything to do with thinking about the device that I'm going to prescribe right up front, and think about the quality of life that my patients are wanting to achieve with their oxygen therapy, because there is a stigma that goes along for some when they wear their oxygen, especially out to dinner with family and friends. I want them to feel confident that that stigma needs to go away, that they should feel confident and comfortable to leave the home and to wear their oxygen therapy, because the device is going to provide what they need to stay safe. And so for me, that compliance care means that they're going to trust and be reassured that I've thought very much about what I'd like them to be able to do from a physician level, but that I've also thought about personally what they're going to be experiencing when they're not with me. And I think that's the concern that I always have with my patients at the very initiation, is what is my life going to be like now that I have to use oxygen therapy? And so finding a device that's going to match their lifestyle, that's going to provide them the right level of oxygen, so that from a clinician level standpoint, I feel confident, means that I can reassure my patients that we've chosen the right device, and more importantly, the right therapy to keep them safe. You know, I think that's one of the benefits of the FreeStyle Comfort for me, again, is it should be seamless. It should be something that is a part of somebody's life, but not intrusive. And I think the idea that the FreeStyle Comfort allows my folks to get out of the house, go to whatever job, some of my folks are still working, to leave the home, but confidently leave the home knowing that they're going to be receiving the oxygen necessary without having to carry something that's heavy, something that's intrusive to their lifestyle, means that the FreeStyle Comfort starts to match the things which, for me, is an important thing, which is quality of life.